But let me also just now properly introduce our speakers. First, we have Diann Shaddox. She is the founder of the Diann Shaddox Foundation for Essential Tremor. After being diagnosed with essential tremor, or ET, Diann founded the organization to educate and increase awareness about ET and to find new treatments and a cure. She is also the author of 7 published books, so I'm a little jealous because I think that's incredible. And then we also have Darlene Lobel. She's a neurosurgeon with over a decade of experience. She attended college at Duke University and completed medical school and neurosurgical residency at the Medical College of Georgia. Dr. Lobel completed clinical and research fellowships at UCLA, Emory University, Mayo Clinic, Clinitech, and the Atomic Energy Commission in Grenoble, France. Dr. Lobel provides surgical treatment for spine, neck, and brain disorders and specializes in functional neurosurgery. She is currently practicing at Neurospinal Associates in Bradenton, Florida. Welcome, welcome. Thanks for being here today.
We are delighted to be here. Yes.
Yes. Thank you.
Of course. I also invite everyone to open up their chats, ask any questions if you also want to tell us where you're coming from. And so, Diann, can you just start by telling us a little bit about your organization, what you do, what kind of inspired you to do this? I know it's a lot.
It is. As Eden said, I'm Diann Shaddox, and I'm an author. And as a matter of fact, it was 10 years ago that I started the Diann Shaddox Foundation for Essential Tremor. I'm an author, and I wrote A Fated Cottage. I've got 7 published books, but A Fated Cottage stood out because it is a story of an artist who is diagnosed with essential tremor. And he's a famous artist, in his life of paintings ends. So it's a love story. But I was out doing book signings, and everybody, of course, asked about the hand tremors, and I could barely sign. And that kept growing. And I had people with the ET coming at me saying, why isn't more being done? You're out here, you've got this. So they just kept emailing and emailing. And I don't know about any of you guys. I was diagnosed with essential tremor in my early 20s. And I hid my tremors. This hand began, then this, and it just progressed. Now, mine was a slow progression, but I kept hiding it from friends and family. And I was shocked when I wrote the book, because the book I wrote was on my birthday, and I was mad because these tremors were starting to interfere with my life. I couldn't type, I couldn't do anything. And so the beginning says, "Happy birthday, dumbass." It was on my birthday. And so at the book signings, people were coming at me. I'm like, look at all these people. I thought I was all alone out there by myself. And I started doing more research, and I started talking to these people, and I knew something had to be done. We're not alone. We're not just a few people out there. And when I learned how many children have essential tremor, I knew something had to be done. So I started 10 years ago the Diann Shaddox Foundation for Essential Tremor. And my goal was to unite the essential tremor community around the world. We are getting this done. I am so excited, because this is our year of ET, because it is happening. People are coming out. People are not sitting back and saying, oh, I have tremors, you know, I can't show that. They're understanding. It's okay that we shake. It's okay to tell the world what we have. And united will make a difference. So that is what I'm doing, and that is what the foundation is doing. And we've got so many things happening. And Dr. Lobel is our president, and she is making a difference in the world of essential tremor. So any questions, please leave questions for me and for Dr. Lobel, because this is the whole point. It's okay to have tremors. So anything else?
I'd like to just hand it over then for a little bit to Dr. Lobel. One, just because if you could just tell a little, because again, obviously I explained briefly, but I loved the fact that you looked at people as people, that it wasn't like, I'm here just to fix something. You were just so incredible that I got very excited. Like I was like, she gets it. She sees a person, and I think that's so important.
Oh, thank you, Eden. I'm so happy to be here and to share with you all today. You know, in training in medical school and residency, they teach us a lot about diagnosis and root cause medicine. And okay, here's the problem. So here's a medication or here's a surgery to fix it. I was never really satisfied with that, right? And I practiced for a number of years straight out of residency and fellowship. And then I took a short hiatus from practice because I had adopted my children and I wanted a little time with them. So in that time, I actually wrote a book. One of my first books that I wrote was for patients with essential tremor. And I decided initially I was going to talk about to help people understand what deep brain stimulation is, which is one of the procedures that we do for ET. And it really helps tremor, cuts it down by 80–90%. And so I started doing research, and I found over 50 ways that tremor can be controlled that are not medical and not surgical. And this started me actually on a journey where I wanted to investigate not just traditional medicine, but even acupuncture, therapy, Tai Chi, all kinds of nutrition, right? And then I began to start studying about mindset. And I found that there's literally a pathway in your brain for any health condition that you have. And that pathway has to change before you will ever heal. Okay. We actually set limits in our mind about what we believe is possible. And this is a reason why a lot of people don't get well. They're told, oh, well, you can take one med or this other med, or you can get surgery, and that's it. And until we begin to say, what if? That's my favorite question to ask patients. I say, what if? What if there was something else? What if there were another way? What if you woke up tomorrow? Let's just imagine, let's take a magic wand. What if you woke up tomorrow and you didn't have tremor? What would your life look like? And I'll tell you what, you can see the expression change on people's face, right? When you ask that question and they start to dream and they start to wonder. But what's even more amazing is the neurochemical changes in the brain that happen with that actually set off a cascade of events that helps to improve tremor and even symptoms of other movement disorders such as Parkinson's disease, okay? I also personally am a very spiritual person, and I have found that those that are open to faith-based discussions have even greater recovery. So I started to see as I was doing online consultations, and this was, you know, right in the middle of when the world was shut down, right? Nobody was going anywhere. And I would start to see that the more people would engage with all different modalities of healing, that those individuals would get better faster and would heal to a greater degree. And it was just so amazing to me. So when I came back into practice, I changed the way I practiced completely. And so now when patients come to see me, I tell them, I said, look, you need an hour for a new patient. And they're like, an hour for a neurosurgeon? What are you talking about? Just put up the film, show people what you need to do. And I said, no. We're going to talk about everything. I want to hear about your life. I want to hear about what your passions are, what inspires you, and why do people make the choices that they make, and these sorts of things, even with diet, nutrition, and these other things. And it has just really changed so much about how patients do, those that undergo deep brain stimulation, if that is appropriate for them, they wind up doing so much better. I did some research when I was up at Cleveland Clinic. That's where I practiced for a number of years a while ago. And we actually studied depression and anxiety in patients that had had deep brain stimulation. And what we were looking at why some patients who had deep brain stimulation, their tremor got a lot better from a doctor standpoint, but the patients weren't happy and they didn't feel like their tremor got better. And so we started looking at, well, why is that? I can clearly see the tremor went from something like this to very, very mild. Why don't the patients think it got better? If they were diagnosed with depression or anxiety, they were unable to see the benefit, literally unable to see the benefit of the treatment. So when I tell you, people say, oh, mindset, that's a bunch of woo-woo science. No, it's not. It's actually, we did a randomized controlled study with all of this, right? We looked back at all of this, and it makes such a difference. So I want to encourage, and we'd love to actually open discussion here and hear from you all about what is it? What do you love to do? First of all, what do you want to be able to do? Because there are strategies that we can give you, and I'd rather personalize this while we're on the call today. So we can take, if folks want to share, and we can give you some. I'm not giving you official medical diagnosis. I have to give a disclaimer to keep everybody happy, but can give you suggestions based on things that have worked for other individuals. And I do want to just echo to one of the things that Diann said. And Diann, you talked about hiding. And I want to applaud each and every person here for not hiding, because you're here, right? You're here to learn more. You're here to get information. And once you get over that initial bit of fear of coming out of hiding, I'm just going to come out of hiding, you will start to see a more rapid transformation than you can imagine. So that was what I wanted to initially share with you. But I'd love to hear from anyone that wants to share a little bit of your story or anything you're struggling with, and we can chat about it.
You can come off mute. Like I do see Carol. I don't know if you are off mute. I don't know if you wanted to share something or you just happen to be unmuted.
I have something I'd like to share.
Yes.
Okay, real quick, I'm going to try and make this quick. I've had shaking all my life. And I mean, since as far back as I can remember. And every time I went to a doctor, they'd see that my hand was shaking and they'd say, why is your hand shaking? I'd say, I don't know, you're the doctor. I'm 74 years old. And they would never ever say, oh, he must have essential tremors or something. And it wasn't until I was diagnosed with Parkinson's disease, I finally got some medication to help. But it was like every doctor I went to just blew it off. They would just, oh, okay. And I've lived with it. I just didn't bother me. And I used to do a lot of hand work and everything else. And I remember real quickly, one of the things that was really funny was every time I tried to use a Phillips screwdriver, I would try and do it. It was really hard to do it. And everybody would say, well, here, let me do it. I said, no, I got it, and I just was able to do everything. I mean, it was hard, but I just never gave up, and I was never ashamed of it. But anyways, I just thought I'd throw that in there. But Nobody ever said, hey, you got essential tremors.
Yeah, thank you for sharing that story. It's interesting to me as a physician that so many doctors don't know how to diagnose tremor and don't take it, I'm going to say, seriously enough. Okay. Because essential tremor, Parkinson's disease, many other movement disorders are disruptive. They're disruptive for your life, just like you were describing. Like, look, you want to use your tools, you want to, independently, fix whatever it is that you were fixing. And that disorder keeps you from being able to do that. And, in medical school, it's quite interesting. I'm trying to think. I think I got a 30-minute lecture in 4 years of medical school on movement disorder. Okay. Like, I could not tell you the difference between any kind of tremor when I got out of medical school until I went into residency and fellowship. I mean, I did a total of 2 years of fellowships in order to be able to understand this, but it doesn't take that long to know the difference in a resting tremor with stiffness is most likely Parkinson's, and then an intention tremor where you're trying to write or eat or, button buttons or whatever you're trying to do, type on a keyboard, is essential tremor. And so one of the initiatives at Diann Shaddox Foundation that is so important to us is to increase awareness, not only in the general public about essential tremor, but also among healthcare professionals, so that they know when they ask a patient in front of them to just sign their name for something and they happen to see them shake, to stop and say, you know what? Either let's do a more thorough exam, or to refer them on to a neurologist who can get a better diagnosis, because I am equally as frustrated as a physician at the lack of attention to movement disorders. I mean, ET affects, I think the latest numbers that I saw from last year are 10 million in the United States diagnosed. We used to say 10 million worldwide, but the latest numbers are 10 million in the US alone diagnosed with essential tremor. And I think that is extremely underrepresented, right? I mean, we're seeing, if you look at the percentages, the prevalence, they say 10% over the age of 60, 5% over the age of 40, and then it affects a lot of children too. We're starting to see more and more children coming with essential tremor. People need to know about this diagnosis. Doctors need to know how to diagnose this and not sweep it under the rug, right? This is something that really needs to be investigated from the teaching side in the medical schools. And so that's another initiative that we are working on as well. So
yes,
thank you for sharing that.
Actually, she stated that she's had it since childhood. Lisa said, I used to practice Tai Chi for 13 years. I found the tremor in one hand because it became problematic and more challenging to feel the form movements rather than the tremor. And Joe, you have a question.
Yes, I'm wondering, I have essential tremor. I was diagnosed my 30s or 40s, and I was diagnosed with Parkinson's disease about 5 or 6 years ago. And I'm wondering about the overlap. I've read some scientific journals that say that a movement tremor is possible with Parkinson's disease, and whether or not essential tremor and Parkinson's tremor, resting tremor, can overlap. Can you have both with Parkinson's disease, or are they separate?
Yeah, those are great questions. Well, tremor is complex. Let me start there. There are specific criteria for diagnosis for Parkinson's disease, including, we do imaging studies such as a PET scan or a DAT scan to actually look at the amount of dopamine in the brain to see that it's less than it should be, it's unequal. That's a way to diagnose Parkinson's disease along with the clinical symptoms. Essential tremor doesn't really have a blood test or a imaging study. We do get those just to make sure there's nothing else going on, but we are able to identify it based on that. We call it an intention or an action tremor. So when you're trying to do something. Now, I believe the latest numbers that I've seen is that there's about 20% of individuals who are diagnosed with both Parkinson's disease and essential tremor. Okay. So, and that was not studied very well, I would say, even when I was doing my fellowship. I mean, those numbers were not well known at all. It was like, well, you had one or you had the other, but we're beginning to see more nuanced combinations, I would say. So certainly you can have both. They are treated differently. There's more dopaminergic medications, obviously, for Parkinson's disease, and the couple of medicines that are really approved for essential tremor right now are really medicines for something else. There's a lot of clinical trials ongoing right now, phase 3 clinical trials, studying different targeted therapies for essential tremor. So working on the specific cells and the chemical makeup of those cells to help reduce that tremor as well. But you can have both. Again, Parkinson's is more of a resting tremor. It's called a pill rolling tremor. So sometimes, things like this, whereas with essential tremor, it comes out more when you're trying to drink from a cup, for example, or trying to write and that sort of thing. So, Joe, did that help answer your question?
Yes, it did. Thank you. I have both a resting tremor and a movement tremor. And although the resting tremor is more obvious to most people, the essential tremor is more intrusive in terms of trying to do anything. And I haven't been able to sign my name. In fact, I'm trying to learn how to sign my name with my non-dominant hand, which is an interesting experience.
Okay. Yeah.
But I guess I'm part of that 20%.
Yeah, I guess so. Have you tried some of the, there's weighted pens,
Oh, yeah.
there's,
Yeah.
You've tried all of those things. And then
Liftwear
there's some newer.
It's great.
I'm sorry, say again?
Liftwear is great.
Oh yeah, Liftwear. Yeah, that's a good company as well that actually has some like weighted spoons, weighted bowls and that sort of thing. So those are some wonderful strategies to help with that. There's also some newer devices, like there's a Calitrio device, there's a Willem ball that I just saw another new device, and the name is escaping me right now. But basically, it's a wearable. You can wear it on your hand, and it helps to counterbalance the frequency of the tremor. So that can be helpful. And then if those types of things, along with medications, diet changes, there's a lot of things you can do along those lines as well, aren't sufficient, then deep brain stimulation can be an option. It's interesting for patients that have both Parkinson's and essential tremor. I'm always asking myself, where do I put the lead? Because it's in a different location, right? So for essential tremor, it goes in the thalamus. For Parkinson's disease, it goes in the subthalamic nucleus. We have to always weigh out with the patients, what is bothering you the most, right? And, the good thing about placing a deep brain stimulation lead in the thalamus, even if somebody had Parkinson's, it actually will help that tremor as well. So it doesn't tend to help the other symptoms of stiffness and slowness in movement. But if the most bothersome symptom certainly is ability to write, ability, to eat and these sorts of things, then, that is a choice as well. So lots of considerations, and really is why it's so important that every patient has to be individualized.
Thank you.
I think we just lost her. I'm sure she'll be right back. She was actually dealing with a family emergency, so it was so lovely that she was able to be here, which is why she was in the car. So I'm going to hold a couple questions for her, but I do have one. Diann, I thought maybe you could have some insight in. We had someone ask, like, explaining to the grandkids why the hands are shaking. Like they're around age 7 and 9. Do you have anything like how to explain this to people, like why my hands are shaking?
Well, I have grandkids, so
Mm-hmm.
the best thing is to just be honest and explain it to them.
Mm-hmm.
You know, don't try to hide it. Don't try to cover it up. Um, and that's with everyone. When I meet someone, kids, anyone, I used to, about 20 years ago, well, I have worked even longer in school systems. I was one of the top volunteers for each school system as my kids grew, and then grandkids, and then I helped schools in their reading and doing. And I would go in and talk with the kids, you know, to help them read or do whatever the teacher needed me. And they saw the hand tremors. And in the beginning, when I'd first go in, they would laugh. They would, oh, look, you know, and you don't take that seriously because that's a kid. But as I would talk to them and show them that it's like I've said before, it's okay to tremor. I would discuss with them, this is a disease, this is a problem. It is a disability like any, and the nice thing is children nowadays are seeing disabilities. So they're starting to understand more. But talk to your children, your grandchildren, and explain that this is something you do and it's okay. You know, I can still do everything. And the other thing is, you have to realize there are a lot of families who it's inherited. So you start having the children tremoring. So you've got to be careful and watch and treat the tremors like you would any disability, but don't make a big deal out of it. Mm-hmm. That is the key. Don't make it like, I can't do this, I can't. No, yeah. I grew up with a grandmother who had a disability, who had lost her right hand. Mm-hmm. And I didn't even notice it. And if you don't make a big deal out of something, nobody pays attention to it. The children don't. Mm-hmm. And when I like to have my grandchildren help me cook. And when I'm doing flour and stuff, they giggle, they laughed, you know, because flour would go everywhere. If Mama can do it, it's okay. We can make boo-boos through the kitchen. And it became fun. And then it just becomes non-event. So please, yes, teach your family, the young ones, about essential tremor, and it's okay. And what's interesting is they come up to you and want to help you. Mm-hmm. And that's a good learning thing because you can let them measure stuff. Because anybody with essential tremor, if you need a 4th cup of sugar, sugar or anything, let them do it. And it teaches them and it helps you. So enjoy.
Well, thank you.
I'd like to jump in here again with a real quick comment. Mm-hmm. I mean, I've handled this for about the past 5-7 years where it got really bad. I can't even print without, I mean, I had, all that time, I've never had anybody refuse me. I've gone to the post office, anybody who asked me to fill things out, doctor's office, I just say real quickly, I can't write. I've got tremors and I can't write. And I've never had anybody say, oh, okay. But they always come back and say, oh, okay, I'll fill it out. Just tell me what time to dinner. And I've never had anybody say, no, I can't do that for you. I mean, everybody. It's just amazing. I was telling people that because it's, you just got to ask. That's all. And just explain to them what it is. And I've never had anybody say anything about it. The next thing they do is just jump in and start filling it out. So a lot of times I was giving my driver's license along with it, say, here's my address, here's my name, how to spell it, and everything. But I never have a problem. I just thought I'd throw that in.
Eden?
I've had the same experience, Nick, when people ask me, well, just write down your name and phone number or your name and email address. I just say, I can't write, I have a tremor, and they take over. And I'm not embarrassed. And nobody's ever said no.
Yeah. Eden, this is Cher Madsen. I'm actually part of the Diann Shaddox Foundation and have been for 7 years, I guess.
At least.
At least. But I have something to share with Joe. My mother was diagnosed with Parkinson's when she was about 60. And she discovered she was treated with all kinds of medicine, stuff that really wasn't helping her. The tremors were just awful, for her. Finally got her to a movement disorder specialist at a teaching college. If you've got one around, that's where you need to go. Because so many of the neurologists, as Dr. Lobel said, do not understand essential tremor. And when they can't address it, a lot of times they do push it off because they don't know what to say to you about it. But she finally was diagnosed with both essential tremor, which was dominant, and Parkinson's. So she had both conditions. And, I watched her struggle. My mother was a concert pianist, and she completely lost her ability to play. It was disheartening, to say the least. But she started doing research, and I started doing research because I've had essential tremors. I was diagnosed officially at 17, but I'm pretty sure I had it before that, because I also come from a family where I got double whammy. My father had it, my mother had it, my mom's mom had it, I have it, my brother has it, my son has it, and we're hoping my grandson doesn't inherit it. But that's when I met Diann, when I was doing research for this, and we found out we're kind of kindred spirits in a lot of ways. But there are a couple of things. Joe, for one, I'll tell you what I did for my mom. We went to the bank, got a copy of her signature from one of the papers she had signed for them when she could sign, okay? Asked them if we could get permission to have a stamp made so that she could stamp her signature, and it matched what was at the bank. And they said, that's perfectly fine. And it worked great until at the age of 82, she had deep brain stimulation. Okay. So it doesn't have to do with age. It has to do with, and correct me if I'm wrong, Dr. Lobel, it has to do with a number of things. They test your health, your mental health, and you have to go through a bunch of different tests, and she qualified. So at 82, she got both sides, which they don't do very often right away. But it gave her the ability to be able to write, to be able to play the piano. I actually have a recording of her playing a concert at 85. So, there is hope, Joe. And Diann and I have found out two things. Number one, my favorite saying is, yes, I have essential tremor, but it doesn't have me. I am not essential tremor. It's part of who I am, but it's not me. You have to keep a positive attitude. You have to learn to laugh at yourself, because you do some pretty crazy things. And you have to learn that some things you can't do the same way you used to. You learn to adapt, and you have to slow down. You cannot rush through things with essential tremor, because it only makes it worse. And it also increases your anxiety, which is not a good thing. We almost all of us have it. And you have to focus on what you're doing. And if you do those two things, many times you'll find adaptations to what you thought you couldn't do anymore, but you can.
And then we do have, speaking of, as you said, musical, like a concert pianist, we do have a question for Dr. Lobel. This is a little multifaceted. Anne wrote, I have noticed my ability to play my violin is being affected, although it has been an issue for at least 20 years. My neurologist has eliminated the 3 main drugs as effective solutions. So one question I have is, what exactly are the medical treatments of essential tremor? But now they're talking about brain implants. My daughter told me that there is a focused brain ultrasound treatment that's about 70% effective. How common is this? What would be the side effects? So I do want to ask, like, one, what is actually the medication? What is this treatment? But then also you and I had talked about the holistic. What are some other treatments that can be done?
Absolutely. So the 2 medications right now that are most commonly used for essential tremor are propranolol, which is also a blood pressure medicine. Some of you may know it more as that, or primidone, which is another medication that we use sometimes. They tend to reduce tremor in about half the people that take it. And a lot of times what I see, so essential tremor can be progressive. And so even if the medications work for a while, they may not work forever. But I also have, some patients have been on it for 30 years and doing great with it. So those are the 2 medicines. Let me talk a little bit about holistic, and then I do want to just touch on your question too about DBS or deep brain stimulation and focused ultrasound, because they're very different, and some different things there. But yeah, so what I like to start with, first of all, so when I'm assessing a patient, I'll start with the basics. I'll start with nutrition, because you would be shocked to see how some small changes in diet can completely change your degree of tremor. And one of the things is sugar, raw sugar, or sugar substitutes is one of the most offending agents with tremor. So it causes, when we eat products with a lot of sugar in them, it causes these shifts in our blood sugar, which in a patient without ET, without Parkinson's disease, will actually give you a tremor. This is why, if you've ever, maybe you can remember back to when you were a kid, or if you have kids and grandkids, right, and they eat a bunch of chocolate or candy, right, and they can get shaky. So it actually affects you too. But one of the good things, one of the studies shows that if we can reduce and not totally eliminate, I don't believe in hard elimination of anything, right? We've got to live our lives. But if you can reduce the amount of sugar that you eat on a regular basis, you can begin to see some long-term sustained changes in the degree of tremor. There's also 2 diets that have been studied very, very well. The easiest one to do, I think, is the Mediterranean diet. And that's really just what I call clean eating, right? So it's shopping around the periphery of the grocery store, right? So you're eating like fresh fruits, fresh vegetables, choosing olive oil rather than butter. You know, you can have meats, absolutely, but lean meats and fishes and that sort of thing, nuts, and you will find your body starts to crave these things that are healthy for it once you introduce it to your body, right? And so it's always funny to me when I talk to patients, I'm like, the Mediterranean diet, and they're like, oh gosh, no, I can't do that. And I say, okay, well, here's all the choices you can have in the Mediterranean diet. What do you think you might like? And they're like, well, you know what? I love almonds. And I say, okay, well, why don't you add 30 almonds to your diet every day? They're like, that's a lot of almonds, Dr. Lobel. And I'm like, yes, it is. But guess what? When you eat 30 almonds, you're not going to be eating a Hershey candy bar, right? You know, so you're going to fill yourself up. So I say, pick one thing, start with it. The brain actually does really well with small changes. It is, for most people, now there are those people that are kind of the jump out of the airplane people, you know, like all at once, let's just dive all in with everything. But for most people, the brain has sustained changes when we introduce things to a small degree. And I say the same thing with exercise. You know, I talk to patients about like yoga and Tai Chi, right, have been shown to really retrain those brain pathways I was talking about in the beginning. And people say, oh, I can't do 30 minutes of this. And I say, you don't need to. You know what you need to start with? 2 minutes. I say, 2 minutes? What's 2 minutes going to do? And I said, it's going to set up a brain pathway that's going to teach your brain that you like to exercise, right? You like movement. And so you'll start to crave it. So even if you do 2 minutes a day, eventually you're going to be like, you know what? Today, I think I'm going to do 5 minutes. And that doesn't mean you have to do 5 minutes every day from then on out. You know, you set the bar at a certain level and you will start to see the brain works on, it loves repeating patterns, right? It's actually so easy to form habits. People say it's hard to form habits. That's because they're doing it wrong, okay? So you start with these small changes. So those would be a couple of things that I think most people can do. And here's another key that's really cool. I don't have enough time to talk too much about this, but if you struggle to do any exercise, like let's say you have some other health conditions that make it really difficult for you to exercise, there is a network of cells in your brain. This is my favorite part of the brain that I've ever learned about. It's called the mirror neuron network. Like you look at yourself in the mirror, neurons are the brain cells, network is just a group of cells. Those cells cannot tell the difference in whether you're imagining yourself doing something or actually doing it. So if you move your arm like this, or if you imagine, you close your eyes and you imagine yourself moving your arm, but don't move your arm, the same cells get activated in the brain. So even on those days when you don't feel like exercising, you can literally close your eyes and, you know, engage with it, right? Don't just do it half-hearted, but really say, how would it feel to move my arm or move my legs in a certain way? How would it feel to walk, right? What would even sound like? Where would I be walking? Would I be walking on pavement and I would hear the sound of my foot on the ground, right? Or would I be walking on the beach and I get to listen to the ocean waves in the background? Engage with all your senses like that. And it's really, really powerful for you. So start with some of those things. That's where I start everybody, right? I mean, you don't come into my office, and very rarely does somebody come into my office and I say, okay, you're ready for deep brain stimulation. Usually that's because they've been evaluated by a movement disorder center and they just wanted to change doctors, right? Then that case, we'll definitely talk about it. But otherwise, you know, let's start with what's all around you. You know, these are not really new treatments for movement disorders, but they're treatments that haven't been talked about, and they are treatments. They really are treatments. They are very helpful. So I would start with some of those things. And then let me just briefly touch on deep brain stimulation. As Cher said, it is an extensive evaluation process, right? Like you are evaluated by a movement disorder neurologist, by a neurosurgeon such as myself who specializes. You should always go to somebody fellowship trained in movement disorders. Very, very important for that. Academic centers tend to have those more. I am in private practice now, but generally those are good places to go. You have a neuropsychology evaluation. Make sure that there's no progressive depression or anxiety or dementia. Again, those are not exclusionary criteria. In fact, you know, it's interesting. We used to have a cutoff score, I would say, on the dementia rating scale for deep brain stimulation. And what has been found, and this is more so with Parkinson's than essential tremor, but I think this is important for you all to hear. It depended on the time of day that people took the exam as to what their score was. Like they could get a passing score for deep brain stimulation at a certain time of day, depending on when they had had their medicines. And then they could fail it at a different time of day. So I am really starting to look at look at the neuropsych evaluation in a different way as well. And again, looking at the whole picture, because sometimes, you know what, never do numbers define a person. Okay. And sometimes the numbers that we normally want to put in a box or category, it's not the right thing to do. But deep brain stimulation, it's called a modulatory therapy. So it doesn't make any holes in the brain. It's little leads, little electrodes that get put deep in the brain. So for essential tremor, it goes in the thalamus, and you have a pacemaker, much like a heart pacemaker. It's a pacemaker for the brain. It sends little electrical impulses, and it helps the brain cells to talk to each other in a more regular rate and rhythm. Okay. It is a procedure that is always done in a hospital setting. You usually spend a night in the hospital after the brain leads are placed, and then you get the battery placed or the generator placed a couple weeks later. It can be programmed through a handheld device, all right, which is great. The leads stay in your brain forever as long as they don't break or have a problem, which is very, very rare to have happen. Those can stay in forever. The battery has to be changed every 3 to 7 years, depending on whether you choose rechargeable or not. And patients get about 90%, 80 to 90% reduction in tremor with that. Okay. And even as ET progresses or Parkinson's progresses, right? You can do adjustments with the stimulator, which is really nice. There's side effects with any brain surgery. You can have bleeding in the brain. It's usually less than 0.5% of the time. And usually if that happens, it's not significant, but there have been cases where someone could have something similar to a stroke. So it's important to understand those risks. There's always a risk of infection with surgery. Again, my infection risk is less than 1%. You have to ask your surgeon, what's your infection risk, right? Because some surgeons have more infections than others. And, you know, that would mean that the system would have to be removed temporarily often if that happens. Now, focused ultrasound is a little different. It is a therapy that actually creates a lesion or a hole in the brain, a little tiny one, don't worry, in the thalamus. And the benefit of focused ultrasound is that it's not an actual surgery. So there's no incisions going on, right? Depending on where you get it done, most of the time you have a head frame placed, and they use, it's a MRI guided or an MR guided focused ultrasound machine that just, you know, does a little tiny lesion there, and you can go right home after that. So it's very different. So for somebody, if I were as a surgeon saying, well, I don't think this person can undergo anesthesia, for example, right? I don't think that, you know, their heart might be stable enough for a deep brain stimulation surgery. Focused ultrasound might be a good choice. The results from focused ultrasound are not quite as good as what we see with deep brain stimulation, but they are getting better and better. I mean, it's a much newer therapy as well. DBS has been around since 1987. Focused ultrasound is not quite been around that long. So it is now actually approved. Focused ultrasound is now approved for bilateral, so both sides of the brain as well, whereas it used to only be one-sided, so you had to pick with that. So lots of good choices for treatments, and hopefully that gave you a good overview.
That was excellent. Thank you. We had one question, but I did want to share that Lisa had shared, my major reason for wanting to reduce or control the tremor is not embarrassment. It's that I can't easily serve communion in church services. The shaking often means spilled wine or wafers. I'm clergy, so distributing communion is an essential function, and I want to do this.
Yeah, thank you for sharing that. Yeah, you know, I'll tell you what, when you have a goal like that and you focus on that goal, you have a variety of options available to you, some of which we've talked about today, some of which we haven't talked about today because we would be here all night. You, with that intention, as you focus on the intention, your brain actually will do a very good job of filtering in and filtering out which of the different treatment modalities are good for you. So you will begin to see, it's amazing how the brain works, right? We give it this goal, we give it this intention. It's the mirror neuron network I was just talking to you about. It literally will, if you focus on, you know what, I'm going to see myself serving communion and my hand's going to be steady. Right? The plate's going to be steady when I'm passing out the wafers. The cup's going to be steady when I'm passing out the wine. Your brain will figure out what you need in order to get there, right? You've gotten a lot of information today. There's a lot more information out there that's very good. And it will filter out for you. You know what? For you'll just have this desire for, you know, trying maybe the Mediterranean diet, maybe there's a medication, maybe it's DBS. I don't know what it is for you, right? But your brain will actually do a very good job of figuring it out. It's called giving yourself a goal beyond the goal, okay? So many times with patients, they say, I just want my tremor to stop. And I say, well, why? Why do you want your tremor to stop? And they're like, well, I don't want to shake. And I say, I understand that. But what are you going to do when your tremor when it's not there anymore, right? What is the goal beyond the goal? See, when you give your brain that goal, it presupposes that the tremor has already stopped, because you can't get to that without the tremor stopping, and it builds those pathways for you, and it'll help you figure out exactly what you need. Your brain's most amazing machine in the world.
And then speaking of kind of piggybacking on, because you had talked about when you kind of picture it, somebody asked, Laura asked, would practicing laughing on purpose be good exercise for someone with essential tremor?
Yes, actually, laughter is one of my favorite therapies. Thank you for asking that question. That's wonderful for essential tremor and for Parkinson's, because you actually get a dopamine release in addition with laughter. It doesn't have to be a genuine laugh. We've done studies on this. Scientists have done studies on this. Even if you force yourself to laugh, right? I have a colleague neurosurgeon. He does this every day. He does 10 belly laughs every day. It's first thing to start his morning, right? And he's like, starts off, and some days, you know, you may wake up grumpy and you're like, ha, 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 you know, like, I don't really feel like laughing. But after you force yourself to do that enough times, you wind up engaging, right, with the laughter in a genuine fashion. It's because the brain is reacting to it. So yeah, that's a very powerful therapy, actually.
And then Christine said, I don't have a so-called tremor, just a movement disorder. So would deep brain stimulation do anything in my condition?
It depends on what the movement disorder is. So deep brain stimulation is approved for essential tremor. It's approved for Parkinson's disease and even non-tremor dominant Parkinson's disease. I want to mention that because not everybody with Parkinson's has tremor. So it can be very helpful with the stiffness and slowness of movement. There's a couple of other rarer movement disorders, so it would really depend on what you have, and there's a different evaluation process, so I don't want to generalize with those, but there are, it's a freezing gait. Oh, okay, so I'm assuming you have Parkinson's, most likely, with that freezing gait. So DBS in particular does not help freezing per se. And so if that would be your main goal, I would say that would probably not be a good choice for you. Okay. But it can, if the freezing is caused by some of the other symptoms, you know, like the stiffness and the slowness of movement, and it just progresses to that freezing, it can help those. And so you might not freeze as much, but I would not have freezing as a primary goal to recommend DBS for someone.
Any other questions? Thank you, Nick. I guess one question I have though is, what would you like the takeaways to be? You know, like kind of like if you guys leave this program with anything, I really hope that you take away that even children can get essential tremor, that, you know, it's all over, that there's hope, that there's, what would be your takeaways, Dr. Lobel and Diann? What would be your takeaways?
Yeah, I'll start and I'll let Diann end, if that's okay with you, Diann. So for me, I want everyone to know that essential tremor does not define you any more than any other movement disorder. To me, that is the most important thing, that message that I can get across. That is not, it is a condition you deal with. It is a condition that impacts your life greatly, absolutely, but it is not who you are. And the more you can connect with who you are, you will begin to see that the symptoms will become less invasive in your life. Okay. When you, it's one of the reasons why I love the patient council that Diann has put together with the foundation, because they get together and they have passions that they share, right? In addition to, yes, one of the passions is sharing the word about essential tremor, right? But there's so many other things. So that would be the message that I would want everyone to have. And then I will pass it over to our founder, Diann.
Well, the message I want is, like I said, I know people say they don't feel alone, but there are so many people out there who have felt alone and feel like, you know, because we do get tired of being out and saying, you know, people look at us and no, it's not Parkinson's, it's essential tremor. What is essential tremor? And then you have to go through the whole thing to explain what is essential tremor. Well, for me, I get tired of that. So my goal is to let the world understand what essential tremor is. And that's being uniting the essential tremor community, because we've got to let everybody know that we are huge. We're millions strong. And that that is our goal with the foundation, is awareness and to tell the world so everybody doesn't have to keep saying what is essential tremor. Now, one thing I do want to say is I know a lot of people have trouble trying to get diagnosed. Do the best you can do. We do have a list of doctors on our website. You do need to see, if you can, a movement disorder doctor, a neurologist. If you go to your own, just, you know, regular doctor, talk to them, tell them, because a lot of doctors don't pay attention, like Darlene said. It has been ignored, and a lot of them don't think about tremors. Talk to them. Be strong. Tell them, I have tremors. What do I need to do? Who do I need to see? What can be done for the tremors? Get your information together. Google. That's what we all have to do, is Google. Google. You can go to the Diann Shaddox Foundation. Find information. Knowledge is what you need, because if you don't have the knowledge about essential tremor, the doctors, we are going to educate our doctors. We are going to show the doctors what essential tremor is and get them to say, oh, okay, let me look this up. Let me find out more information for you. But you're going to have to be the strong person to do this, because we are working constantly trying to get the medical community to understand essential tremor. That until will be the world will start to understand essential tremor. So get your information, be strong, talk to your doctors, find movement disorder doctors if you can, and talk neurologists if you can, and learn about essential tremor. And we're here to help. If anybody needs help, you know, contact us. Darlene, Dr. Lobel is out there. She's available, and we have other doctors. And that is our goal, is to help assist and end the suffering for essential tremor by so many people. So that's what I want to do.
Thank you so much. We are out of time. I really do encourage, because we put a lot of links in the chat, especially with how to follow up with the Diann Shaddox Foundation. If your chat is open, you'll see the title of the chat and 3 dots. If you click on it, you can save your chat. We put the information about her books, the foundation itself, how to find the good doctors. So Diann, Dr. Lobel, thank you so much for today. This was incredible. As always at PMD, we have our wave of I like that too, Laura Lou. We have our tradition, our wave of gratitude. Thank you so much. And thank you everyone for sharing your time with us today.
Thank you.
Bye-bye.
Have a great day, everyone. Bye.